Hi, my name is Dr. Lisa Nagy, Nagy. I am presenting a talk on environmental and integrative medicine and the approach to postural tachycardia and adrenal insufficiency caused by environmental exposures like mold exposure and long COVID, and the ensuing development sometimes of food sensitivities and chemical and electrical sensitivity in patients who are sometimes disbelieved by their doctors and thought to have maybe a psychiatric problem. So I'm going to do a little interview on how to take an environmental history, how to diagnose somebody with POTS and treat them, and use her as a great example of a real human being who is, as we speak, getting better. So Taylor, why don't you say what you think so far about what you've learned or what you've experienced? How'd you get sick?
So I have had anxiety my entire life. My first panic attack was at the age of 7 and have just never really gotten better. I lived in a house with a chronically damp basement. We took on water every time it rained, and just always exposed to that like mold and just mildew and musty smell. I have been on anti-anxiety medication for the past decade and just trying to get better. Through a series of TikTok videos, I saw people talking about POTS and how when they stand up they're getting dizzy, and that's something that I experience frequently. So I just started doing some more research, knowing that like high sodium is something that is good for me. I don't try to limit that, so just trying to get better and be proactive in my health.
So what was it like to bump into somebody who happened to know about POTS? Was it refreshing in some way because you hadn't really found a
Yeah.
physician who knew about POTS?
So in the past, I've gone to my doctors. I wake up in the night sweating. I get really like red feet when I'm standing, and nobody really listens to that. And then to have Lisa just say like, "Yeah, this is normal," was refreshing because my doctors at home are not aware of POTS or any of the symptoms, and they're not really proactive in treating me.
And what did they say they thought was wrong with you?
They just diagnose it with anxiety, and then it's symptoms of my medication.
And have you been put on medication for anxiety that maybe could be useful for POTS, but really was being used just to cover up
Yes.
the anxiety from
Yes,
it?
so mine was just for anxiety, but learning that the SSRIs are also helpful in treating POTS as well.
Well, what I was talking to you about, what are the names of the two medications you're on
I'm
now?
on Buspar and Zoloft.
Okay, so I had a very good conversation and support from Blair Grubb in Toledo, who's a cardiologist specializing. He's probably one of the world's experts on POTS. He's a researcher looking at the platelets and serotonin granules that release, obviously serotonin. They're decreased in 93% of POTS patients. So if the serotonin is decreased, that explains why Prozac is sometimes useful, or Zoloft in the SSRIs, in increasing serotonin and decreasing some of the symptoms of POTS. So I wouldn't suggest to use those because of the sexual side effects, and it kind of blunts your personality if you don't need Prozac. It would be better to maybe use midodrine, Florinef, stockings like compression socks, or to the thigh high, waist high, or abdominal binder, and not to just medicate with things that are not really helping the patient to get to the cause of the problem. And then after the person's better on the midodrine and Florinef, they can maybe get to the cause of why they have the nerve damage in the first place. So the idea would be, is it mold exposure? Is it ongoing? You need to stop living in a moldy place, and the clothing can be contaminated with mold and mycotoxins. And these mycotoxins and chemicals produced by mold can be measured. And there's some laboratories, I'll just mention them. I have no financial relationship, but Real Time Labs does mycotoxin assessment in urine covered by Medicare. And otherwise it's about $300. And then there's Mosaic as a lab, and also Vibrant. So anybody who thinks they have mold exposure can test the house at P&K lab, and they can send mold plates to them, and you can hire a tester. You can look at your urine, and you can look at antibodies in the blood at Alletests, Alletess. They do IgG for molds. They named the panel after me. There are 15 toxigenic molds that you could screen for. And then if you know you have this problem, then you proceed to stop getting sick by decreasing your level of exposure to molds in all buildings. Now, teachers often are working in a moldy school. Do you think you've been exposed to mold in any schools?
Yes. So in the middle school that I attended, and I work in the same district, everything is just constantly damp. Um, like the papers are wet always.
Oh my
It's
God.
just like it's damp. Um, I haven't been exposed in that building in a while. However, in the elementary school, like we've had mold growing from leaking pipes. My classroom ceiling caved in my first year because there was a water main break and there's just bubbles of water everywhere. So yeah, absolutely, there's mold exposure.
So, some of my motivation, first of all, comes from becoming very sick myself. I had anoxic mitochondria on muscle biopsy 25 years ago. I was told I had Lou Gehrig's and, pack it up and I was going to die. And really, it's insulting to women who have fibromyalgia, chemical sensitivity, environmental illness, POTS, to tell them they're mentally ill when you can do an appropriate workup by taking the history and referring them to an environmental physician. So there's an Academy of Environmental Medicine, AAEM, and they have a list of practitioners around the country who do bits and pieces of the allergy testing, hormone management. Some know about POTS treatment. And the idea would be to get a broad range of physicians nationwide to know about this in all fields, neurology, cardiology, psychiatry, because there's a real injustice that we have tens of millions of women that have long COVID or have mold exposure or both, and we're not really addressing their needs. And it's largely a problem of men in medicine denying this because it's women who have it. And in fact, I'm going to show you a reference that's pretty interesting from 1893. So this is a publication that is a reprint from the Massachusetts Medical Society second, luncheon lecture that was very important at the time because women were having neurasthenia and exhaustion, and they were being diagnosed with mental illness. So this is the mental symptoms of fatigue. And the other book is called Mental Symptoms of Neurasthenia. So they used to put people on a ward and give them clean food, clean air, sunshine, and they didn't have oxygen tanks at that time. But it basically was environmental medicine at the very beginning, 130 years ago. And nothing much has changed. We have to stop looking at women who have these multitude of symptoms. And instead of saying, oh, I can't figure it out, it's psychiatric, I know what you have. Here's a flyer of information. This is what you do. And so I'm going to teach you over the next few months through experts, myself, how to take an environmental history and give advice to the patient. Don't use pesticides. Change your detergent to unscented. No, dryer sheets or fabric softener at all. And so what you want to do is decrease your total load of exposure, and then you can tolerate new exposures because you have less diesel exhaust, less perfume, no fragrance shampoo. And then after 4 days of living in a clean environment, you will actually unmask and become sensitive to the previous detergent you used to use. And it seems crazy, but this is how environmental medicine started in theory in the 40s, 50s, and 60s. And the book I recommend reading is Theron Randolph, Alternative Approach to Allergies. And he, in 1960, actually treated Mitt Romney's brother, George, and his mother as inpatients for environmental illness. So, Mitt Romney knows all about this because his family went through it, but most people don't really want to get out there and talk about it, their personal experience with environmental medicine. And other people are very chemically sensitive who are famous, like Michael Dukakis. He flies, I've heard, with a gas mask on planes because he's sensitive to jet fuel. And when Kitty and I met for an hour here, she admitted that her depression, which she advocates treating with electroshock therapy, is actually believably related to their very, very moldy basement and house. So a lot of famous people have gone through becoming environmentally ill, but it's the physicians, I think, who need to bring this to other physicians and for medical school education. And the main thing is we can't sell products. We cannot be self-promoting. We need altruistic physicians who want to help educate, who do not benefit financially at all by patent or by anything else that really doesn't help the patient. So anybody wants to help me, they can contact me and say they want to help educate. There's a poster of information that I produced on POTS, and I was going to just show you some of the symptoms. So these are the pictures of what people do when they have fast heartbeat on standing. They cross their arms, cross or pretzel their legs when they sit. They lean on the wall. They study lying down. So I was, lying down my entire life getting straight A's. And then I became a trauma surgeon. And it was a little difficult to stand up operating on people if I really was more comfortable lying down. Kind of hard to go through medical education this way. And I thought this was really a good example of what we all look like in medical school if we have POTS. And you drink coffee, you can use amphetamines or cocaine to counteract the effect of the vasodilation in the legs. So POTS is neurologic, but the veins in the legs dilate, and then the heart is empty. The interesting thing is there are 6 things or 7 things that make POTS worse: hot weather, exercise, eating a big meal, standing up a long time, and low barometric pressure when the rain's coming. So this is why cows lay down, is that they're vasodilating in the venous system, and they get exhausted and they lay down. And it doesn't seem like people in veterinary medicine even really understand that either. The other thing that can make POTS worse is home improvement store, because you can breathe in all these chemicals and it affects the nervous system. And people also using technology like the computer. So we sometimes will sit at the computer and you'll start pretzeling your legs. That's because you're getting less blood flow back to the heart. Now, these are examples of the addictive substances like coffee, cigarettes, Coke. I guess this is an amphetamine. I'm not sure exactly what that is. Maybe this is heroin. And then this is an example of what people will use to counteract also the adrenal insufficiency. So I'm going to talk about that for a second, because a lot of these people release a lot of aldosterone to cope with the tachycardia and try to increase their blood volume. And this will burn out the adrenal gland and give them potentially Addison's disease or adrenal insufficiency. So we want to work that up. And that's also on this second page of this poster. And in Taylor's case, if you're dizzy on standing when you go to do your shoe and get up, that's usually adrenal insufficiency and a lack of aldosterone. And if they crave salt and sugar, then that's likely that they have adrenal insufficiency. They can get hyperpigmentation, they can have low blood pressure, but usually, I see patients who have just POTS with fast heartbeat and they do not have low blood pressure. That's not really a definition of POTS. POTS is defined as being an increase by 30 beats in 10 minutes of standing up, of heart rate on a tilt table. So this is the diagram of a tilt table. This is a person taking their pulse, multiplying by 4 after counting for 15 seconds. They can do that at home on the phone and then tell the doctor what it is. And this is the tilt table. The head's up, the feet are down, you're tied to the table and you can't constrict your muscles, so that therefore you pool. Dr. Friedman's office in Boston is where I've done all my tilt tables, and I have a 90% positive tilt rate. And my patients get better, I retilt them, and they're normal again in a year or 2. So this is also saying that we do an ACTH stimulation test. We do a standing aldosterone level at the hospital. So you stand for 15 minutes and then sit and draw the aldo level. And then 4 salivary cortisols. You can use Senesco or Quest, and a 24-hour urine at Rhine Labs is who I like. And the reason I use that lab is they measure aldosterone, and they also will do pregnenolone. So you get a picture of all the adrenal hormones, including DHEA, cortisol, aldosterone, and pregnenolone. And then you look at the sex hormones, estrogen, testosterone, and you get a real sense of what the patient has. Is it just POTS? Is it just Addison's? Is it neither? Is it caused by mold, or is it caused by COVID or COVID vaccination? And then you can try to piece together what treatment would be good. Now, I gave Taylor 5 milligrams of midodrine about 3 hours ago. And how does that feel?
I feel good. I mean, my head is tingling, which is what you told me to look for.
What
So,
else feels good?
I don't know. Just overall,
You
general
feel
mood.
good
Yeah,
energy.
just
Wow.
okay.
So, her vital signs were really impressive yesterday. So she has what's called orthostatic hypertension, high blood pressure on standing, and when she laid down, it was normal. So it was 170 over 117 and a heart rate of 109, which isn't that fast, but it's fast. And then when she laid down, it was like basically 120 over 80 and a heart rate of 86. So it should be 72. And the blood pressure, the heart rate shouldn't really go up more than 10 beats when you stand up. So she went up from, let's say, 86 to 109. If I had to do math quickly, blah, 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 like 25. So the idea is if it's 20 beats faster in my office, I tilt them. And then I officially prove to friends, family, psychiatrists, everybody, the patient is not crazy. They have POTS. They deserve a test, and they might need disability. So they deserve a test that documents what they have. Because the family members, how are your family members in terms of being supportive of?
My family members do not agree with medical intervention at all. They don't like that I'm on medication in general. So anything that I tell them is wrong, they just kind of ignore me and gaslight me.
Right. So it's not, they're not really supportive. You're a
No,
nice, friendly,
yeah.
sweet person. And here you've got family members who aren't really standing by
Yeah,
you.
no.
And then they label it psychiatric. It's ridiculous. As I smile. Okay, so at the bottom of this, since we're making use of this poster, there are scales of measuring chemical sensitivity that you can download from the internet. Do it, please. Breezy is a very short 3-question test that you can ask your patients about being sensitive to chemicals. So it says, do you feel sick when you're exposed to tobacco smoke and nail polish remover and nail polish and fragrances and diesel exhaust are big? New carpet. Do you get a headache, weakness, or dizziness? That's question number 1. Number 2 is, are you unable to tolerate or do you have adverse reactions and allergy sensitivity to drugs or medications? That is the definition of a chemically sensitive person. Patients who can't tolerate meds, they have chemical sensitivity. They may not know because they're wearing perfume or they're using dryer sheets. And until you're unscented, you can't tell. So they don't know, and you can help them to get there. The third thing is that are you unable to tolerate or do you have adverse reactions to foods like dairy, wheat, corn, eggs, caffeine? And actually, a headache from red wine is the first thing that occurs. Then it's white wine. Then it's, exhaustion from alcohol. And a lot of times, if you ask just a couple of questions, you'll figure out that you have a chemically sensitive individual. What's interesting is that 25% of the population in studies by the government and Ann Steineman say that waiting room patients are chemically sensitive, either mild, moderate, or severe, in 1/4 of the patients in the office. So you're missing them all. And what happens is that women have it 4-to-1. So that means, in my mind, when I do the math, 70% of women over 40 are a little sensitive to fragrance or other chemicals. But if you don't ask, you won't know. So start asking these questions. Now, the Queasy scale is even better because it has columns 0 to 10 with questions about each chemical exposure. And they can circle that, leave it on the chart, and you know how sensitive your patient is. It's really a very well validated international tool that's been used, I think, for 20 years by Claudia Miller. And you just go online and download it. Now, I've written some Massachusetts Medical Society policy to accept these scales to be used in an educational program for physicians. And that'll be coming out in the next 8 months. And hopefully they will say that chemical sensitivity is a real syndrome. And the AMA has said since 1990 that even chronic fatigue is not a syndrome. So they're very outdated. We need to change policy. And the young physicians at the AMA actually have a fragrance-free policy they wrote for medical offices and hospitals nationwide. So they're getting there, but it can move more quickly. I'm going to bring up the second poster. So this is a very interesting statement that was made by the National Institute for Environmental Health Sciences newsletter after I was lecturing there with Dr. Havas and Dr. Meggs about the influence of the environment on obesity, insulin resistance, and chemical and electrical sensitivity, and the treatment methods in environmental medicine, which are really not fringe. It's very legitimate. So what they said was environmental medicine shows promise for reducing chronic disease, which to me is like, I'm very proud of that statement, because if you can look at all chronic disease, autoimmune disease, neurologic disease, psychiatric disease, metabolic stuff, we could maybe get to the crux of a lot of people's problems by looking better at the etiology, but we need to be reimbursed for our time to do so. So that's the problem. It's time, money, resources, and that's why the Queasy scale is a quick way of having the patient do the work. You look at the results, and then you're halfway there. The other thing is, the director emeritus is Linda Birnbaum of that NIEHS, and she was the equivalent, parallel to Anthony Fauci, who was head of NIH at the time, and who's still alive. In fact, Dr. Fauci was here Thursday giving a talk, and we had a little rally to explain to him that when he told me to my face at the Washington Cathedral 15 years ago that chemical sensitivity doesn't exist, he was holding the country back. I'm sure he didn't think it was a big deal, but if he was the lead allergist in the world for 30 years, how could he deny the reality of a fellow Cornell alumnus like me that I had chemical sensitivity and he's wrong? Nice, but wrong. And unfortunately, he wrote the textbook on internal medicine, and it doesn't include any of this. So I'm asking that he reverse his position. And I'm writing a book maybe called Fauci and Me. So we either go off into the sunset holding hands in agreement, and he says that he was in error, or we battle. It's like a David and Goliath story, because at Cornell Med, actually, I have a little picture here that at reunion, I was asking a question about intravenous bags being more toxic than glass bottles in resuscitation of a trauma victim. And I said there's hexane and other materials that outgas basically into the liquid, and nobody thought of that. And we were at a G. Tom Shire's tribute lecture at this reunion, and Dr. Fauci is sitting right behind me. So he has not really responded well to interacting about correcting this problem. And I said that the AIDS victims were able to rally and explain to Dr. Fauci the error of his ways, and he caved and became the hero of the AIDS movement. But initially they were very angry, and I said that sick women with environmental illness can't stand up. You can't go to a rally. You're too fatigued. It's too hot in Washington to go rally. Mm-hmm. So how are we going to get him to listen to us? Even though he's not at NIH now, he could come out and say he understands the importance of this, and the whole country would change. So I have support from people like, I hope Jack doesn't mind, but Jack Spangler from Harvard School of Public Health. He just retired last month. And we're all working together with Linda Birnbaum and Deborah Davis and maybe head of EPA, Ruth Etzel, to look at the health effects of environmental exposures of all kinds, including mold. Ruth is an expert from 1993, and her work in Cleveland at Case Western Reserve on hemorrhagic lung disease killing children from Stachybotrys is a very famous case, and they made a movie about her. This is pretty fascinating. Ruth Etzel wrote this book 3 times over. It's the pediatric, American Academy of Pediatrics book, Pediatric Environmental Health, 3rd edition. And in it is toxic exposure, including mold and mycotoxin exposure, and neurologic disease. So when I do litigation for a patient, all the experts in the country that do mold litigation against patients say there's only pulmonary effects. This is not true. I've seen people with ALS, Parkinson's, MS, and a host of other diseases, which I will go into next time with literature, as well as depression, strictly from the mold. So, if you don't want to believe a patient and you want to make money testifying against patients who are suffering, that's their choice, but they're wrong. And I want to mention an article by Shanessa at Brown University about 15 years ago that said there's a 40% rate of depression if you have mold in your house. And they interviewed, I think, 2,000 people. So mold directly makes people depressed sometimes, not all molds, not all mycotoxins. It could be also from the low adrenal function, low cortisol. where the mood goes down because the cortisol is low. And you take the Cortef, I have Addison's. So I have to take the Cortef, and I have energy. I can move my muscles. My mood is better. I can tolerate the heat. And in fact, you said something about getting hot in the middle of the night.
Yeah.
So the cortisol goes down, it's high. And oh, here, let's look at the cortisol graph. So this is a salivary cortisol, with the cortisol being high in the morning. And then the normal range is in this gray area. And you can see this is a normal graph. And 2 years later, this might be mine. But anyway, 2 years later, flat line, you can see that the person has very, very low cortisol levels, and it's straight across almost zero. And this is the typical thing we see when people are exposed to mold. And it might be that the cortisol is bathing the adrenal gland itself. It's more susceptible to tuberculosis, which was the leading cause of adrenal insufficiency in the past. But now TB is not that common, especially in the US, but mold exposure is. And so I have this great article that is in the animal research literature from the Army. It's Dr. Thurman, 1988. And he said that if you have rats breathing in moldy air with these toxins, they're called the trichosithines, that the rats died, but only the female rats.
Interesting.
And if you gave the female rats a shot of testosterone first, they lived. So there's a steal effect from testosterone to cortisol. So the adrenal necrosis occurs in animals from breathing in toxigenic mold air. It's proven, and now we need researchers like you to pick up this ball and run with it. Do some testing on your patients and some questions, figure out who's got adrenal insufficiency and who has mold exposure, who has POTS. I have all this data. I just don't like writing things up, and I'm going to publish it one day. But the idea is you treat the POTS, treat the adrenal insufficiency within a couple of days. And at the end of this, I'm going to show a brief video of a young guy. He was treated for 5 days, and I showed it in Congress to the Veterans Health Subcommittee and helped to get $100 million appropriated for toxic exposure research in veterans, because this guy got better substantially in 5 days. So hopefully, we can glance at that video right after this, and then we'll close and we'll continue next time with, more research articles and a PowerPoint perhaps. So this is how you work a person up. You look at the mold antibody IgGs, and this is a panel. All the red ones are positive. The scale is 1 to 4 of being elevated on your IgG. And obviously a moldy patient will have lots of red ones. So this is a pretty moldy person. They've got aspergillus, they've got Chitomium, they've got Fusarium, Penicillium chrysogenum, and Stachybotrys, which is a 2. Anybody who has Stachybotrys, it's bad news. So a 1 is very high on Stachy. And so it'd be nice if you have a 0 and you have a couple of molds. But if you have a picture like this, you really need to jump in and do something, because it's likely you're going to get neurologic disease 5 or 10 years. What I see is women in a moldy environment will often get chemical sensitivity and maybe depression or anxiety. But the men will be belligerent, and they won't be chemically sensitive. So they don't believe the wife. And they usually divorce because the man won't cooperate with getting away from Clorox or Lysol or, his cologne. He's like, forget it, I don't want to hear it. And what happens is the woman will take the children and flee the house that's moldy if she knows it. And the man will stay in the house and go down with a ship. And it's really sad to see relationships break up over that. Anyway, now we have, here's an example of a tilt table. So the patient at 3.5 minutes, all of a sudden, the heart rate starts going up it starts at 90, and then the patient's heart rate's going up into the 145 range within the first 8 minutes of tilting. So that's pretty easy to interpret for anybody. And there's another interesting thing I did. I did a study called a sauna study, and I will publish it eventually, but the whole country does this now. So I found a family that had mycotoxins in the urine, 2 children, a husband and a wife. And for some reason, the husband, on subsequent testing, because they were wealthy, so they kept testing, the husband had 0 mycotoxins in the urine, and the wife and kids were still high. And they were doing sauna. They got a new house. They got new cars, new clothes, everything. But what was the husband doing that was different? No sauna. So he was holding on to his toxins. They weren't coming out in the urine. So what I did was I presumed that the sauna was the reason it was coming out. And then I did a couple dozen patients. And what I did was I did a urine mycotoxin test on time equals 0. And then they would get in the sauna. They did a 30-minute sauna at like 150 degrees. And then I asked them to wait 1 hour. Then they would give me a urine specimen and I'd send that. So I sent a pair on each patient. They all went up dramatically after sauna. And sauna therefore shows that you can get a positive test if the first test is negative, but it also shows that it'll treat it. So that if you're toxic and you want to get rid of your toxins, you might need to do sauna for a couple of years. And you start very slowly. Don't do a sauna after seeing this lecture, because your toxins can come out so quickly, you get sick. You get exhausted. You can't move for like 5 days. So what you want to do is like 5 or 10 minute sauna, wait 3 days, then you add 5 minutes. So what the bottom of this is, here, questions to ask your patient. So this is the beginning of taking an environmental history. When did you become ill? Do you have a musty basement? Are there chemicals or mold at your job or school? Are you sensitive to perfume, diesel exhaust, or the detergent aisle of the grocery store? Very important question. Does your cell phone heat up in your hand? Do you dislike fluorescent lighting? Is working on the computer exhausting? That means you are maybe electrically sensitive, which is in 30% of chemically sensitive patients. Yes, it sounds crazy. Don't worry about it. Just believe what I'm saying. And some of you will have this. So don't doubt a person having this for real, because when you get it, you're going to feel guilty that you didn't believe them. Is it difficult to get up in the morning, or are you exhausted at 4 p.m.? So that's adrenal insufficiency. Do you get a headache, fatigue, or palpitations? What did you eat, touch, or smell before you got symptoms? And that's Doris Rapp, my mentor, who's, the late Doris Rapp. She was on Oprah and Phil Donahue many times, got 140,000 letters from mothers about her video. It's called Environmentally Sick Schools. And it's all about teachers and kids in schools that aren't good, that get these syndromes. And there's always like one kid in the class that's more sensitive than everybody else. The main thing about schools, which is really my main thrust, so I'm going to have to explain it. Martha's Vineyard has moldy schools. They're rebuilding them all. They rebuilt the hospital. $500 million for a new high school is in the works. What happens is they get POTS from the mold. Then they become mentally ill and addicted. So what are we going to do about these depressed kids? Teachers that are hanging themselves because of depression? We're going to call this normal? That, this teacher had this problem and that's the reason? No, they're usually environmentally ill. They should have been addressed, treated, and helped. And so I'm on the health council here. I'm working with the hospital here, trying to get them just to check a standing heart rate on everybody in clinic, everybody at the nurse's station in the school, identify who has POTS and refer them. So that's my main gist. Now, these are the links. If you want to see the Netflix series done about some of my patients, it's called Afflicted. And in episode 6, it features me talking to a person who is sick from this, and they interviewed each patient for 1 month. It's a pretty profound show. And what's funny is that when I go to Logan Airport from Martha's Vineyard, people sometimes recognize me in the airport and stare at me and they say, "Oh my God, I saw you on TV." So anyway, I'm getting out there, but the more I educate you as traditional physicians, you can help so many of your patients by expanding your practice just slightly. The books that I recommend that the patient read or the doctor read are Living with Environmental Illness by Stephen Edelson, as well as the Randolph book, Alternative Approach to Allergies, that I mentioned before. So I'm going to ask if Taylor has anything else that she wants to say in closing, and then I'll show you a quick video of a guy who really was very convincing that got better. And then hopefully, we'll do subsequent lectures by myself, as well as experts like Jack Spangler or Deborah Davis or Linda Birnbaum talking about different aspects of environmental health so that we can bring their scientific information and research to the clinician. So what do you have to say so far? Oh, yeah. How do you feel now that your midodrine, we start with usually a small dose and then go up and up and up over one day. So you said you feel a little bit better, and the plan is to give her 5 milligrams of midodrine. Often I start with 2.5, and then every 4 hours I go up to 7.5 and then 10, and see by tomorrow what her necessary dose is, and she takes that Q4. And then if we need it, we'll add Florinef in the future. She can go home. I can treat her from a distance because she's been here and examined by me. And tomorrow we're going to do an ACTH stimulation test and get her baseline, cortisol response. So how does that sound?
It sounds great.
So you're in the mood to get better?
Yes.
Yeah. So she's smart. Isn't it amazing? I just bumped into this smart teacher who grasped all the stuff and was willing to tell you her story. Anyway, thank you so much. I think what I'll do is click a video and then close with that.
This is Lisa Nagy. This is a patient who has come for treatment for the past week and wanted to give a testimonial for our U.S. congressman and other people to hear about.
Hi, my name's Jeremy. Just want to let you know, I came down here with tremendous anxiety, dependence on cigarettes. I was very anxious. I work in the natural gas industry. I own a business in the natural gas industry, and became very ill over the last 10 years. Now, after having 5 days of treatment here, most of my symptoms are completely gone. I feel so much better. The nervousness, the anxiety, the depression, it's gone. It's lifted. I find that the treatment here has really helped with my positive outlook on life, and it's lifted the veil that I had over my life. It's completely gone. So I think that if whoever's out there listening to this, I think this would benefit anybody who's had exposures to any type of chemicals in their life, any types of molds, anything like that. They would benefit from this treatment. And natural gas, the way we found out that natural gas was a problem is because we skin tested and did an injection of it, and I experienced all the symptoms I've been experiencing for the last 10 years. Came out at once, and it was very enlightening. So now I am treating. I have been given the proper tools to go back and treat myself and stay level-headed, and I won't have to leave my job.
I have one thought. We talked about having environmental exposure lead to problems with the autonomic nervous system and with the adrenal gland. And you've been treated for both of these problems with midodrine and also the hormone Cortef. And it may be hard to tell which thing is doing what, but do you feel that that treatment has been helpful for stabilizing your heart rate and your blood pressure and making you think more clearly?
Definitely, that's helped tremendously. My heart rate is stabilized. As I said before I came down here, I was very uptight. And everything has just kind of leveled off. I'm calmer now.
Yeah.
And my head space is very clear. Like it hasn't been like that for 10 years.
And I think this would be helpful for veterans because they have such a mixed picture of exposures and of symptomatology that we're trying to explain. This would benefit all of them.
I think one more point we should lay out here is that I was about 5 years ago, I was on my way to a psych ward. That's how bipolar and mania,
Yeah.
I had all of the issues, mental issues.
And now you feel pretty balanced.
And now I feel very balanced, and I'm going back to work.
Yeah, amazing. Okay, thank you very much, and good luck.